Hey everyone, and welcome. This is Jay.
And Amber. And we're with Precision Assess.
So glad you could join us. Today we're diving into something really crucial for anyone involved with adult family homes or assisted living facilities right here in Washington.
Yeah, we're talking about care plans, but not just any care plans.
Right. We mean making sure that the plan for each person, each resident, well, it actually fits them.
Exactly. It needs to be, unique, just like they are.
Because, it happens, right? It's easy to just grab a template.
Oh, for sure. You see it a lot.
Like, okay, this person has memory loss. Here's the memory loss plan. Kind of like a cookie cutter.
That's a great way to put it, a cookie cutter. But people aren't cookies, are they?
No, definitely not. And using that approach, well, it's kind of risky, isn't it?
It really is. It just doesn't capture what that specific person needs, like right now, today.
So that's what we're getting into. Why those generic plans are a problem, what the rules in Washington actually say.
Uh-huh. And what makes a good personalized plan. Plus, something called nurse delegation.
Right. How that fits in, helps you give better care, and honestly stay out of trouble.
Okay, so let's unpack that cookie cutter thing first. It's super common, you said.
Yeah, you see places using templates or maybe copying bits from one resident's plan to another if they have, say, the same diagnosis.
Seems like it might save time, maybe.
On the surface, yeah. Like, oh, they both have dementia, this should work.
But that's where the danger really creeps in, because that template, it misses the actual person.
Okay, give me an example.
All right, think about this. You have two residents, both diagnosed with dementia.
Okay.
Resident A gets really, really agitated in the evenings, sundowning, maybe gets a bit combative.
Right, needs a specific approach then.
Totally. Now, resident B, also dementia, but they're calm, except they tend to wander at night. They're trying to get out of bed, walk the halls, big fall risk.
Wow, yeah. Same diagnosis, but completely different needs and risks.
Exactly. And a generic dementia plan that just says, needs supervision. It doesn't help the staff one bit with resident A's agitation or resident B's wandering.
The staff wouldn't know what to do specifically for each person.
Precisely. What works for one might even make the other worse. It leads to confusion, stress for staff, distress for the resident.
And I bet state regulators notice that.
Oh, absolutely. That's a big reason facilities get cited by DSHS. They want proof you're meeting individual needs. Cookie-cutter plans just don't show that.
So clearly, one size fits all is out. For good care and for, compliance.
Definitely.
Which brings us to the rules. What does Washington State actually require for AFHs and ALFs?
Okay, so Washington has specific regulations. They're called WACs, Washington Administrative Codes.
WACs. Got it.
For adult family homes, you're looking at WAC 388-76-10355.
Okay.
And for assisted living, it's WAC 388-78A-2140.
And what's the main idea in those rules?
They both require something called a negotiated service plan or negotiated care plan.
Negotiated. That sounds important.
It really is. It means that the plan isn't just dreamt up by the facility. It has to be worked out together.
Together with who?
With the resident, if they're able, their family or representative, and the caregivers doing the hands-on work.
Ah, so everyone has input. The resident, the family, the staff.
Exactly. It has to reflect the person's actual needs, their preferences, and how everyone's going to meet those needs. It's an agreement.
And you mentioned something else the state looks for.
Yes, keeping the plan current. This is huge. Facilities get cited all the time for outdated plans.
So if someone's health changes or a new behavior starts...
The plan has to be updated right away. It needs to be a living, breathing document that staff actually use day to day, not just something filed away.
Makes sense. An old map won't get you where you need to go.
Perfect analogy.
Okay, so if we're building this living, negotiated, personalized plan, what absolutely needs to be in it, according to those WACs? What makes it personal?
All right, the rules are pretty clear on the details. First, you need to list exactly what care and services the resident gets.
Not just general stuff.
No, specifics, like not just help with bathing. Maybe it's needs help washing back and feet, prefers showers in the morning, uses sensitive skin soap, that level of detail.
Okay, really practical stuff.
Yes. And who provides the care? A facility staff? A therapist? Home health? And when and how is it done? Does it fit their routine, their preferences?
Like how they prefer their morning routine done.
Exactly. Coffee first, get dressed before breakfast. Do they like help picking out clothes? Those little things make a huge difference in making it feel like home.
What about medications? That seems like a big one.
Huge. The plan needs to cover how meds are managed, who gives them, when, how. It even needs the plan for when the resident might be away for a bit, like a family visit. How do they get their meds then?
Wow, okay. That's planning ahead.
You have to. And activities. What does the resident actually enjoy doing? How will staff help them do those things? Not just listing facility activities, but supporting their interests.
Their personal hobbies or preferences.
Yes. And other preferences. Favorite foods, their usual daily rhythm, grooming habits. The plan needs to show how staff will honor those things. It's about dignity.
Right, respecting them as an individual. What about tricky situations, like behaviors?
Good question. The plan must address specific situations. What's the plan if a resident gets agitated? Or if they refuse care sometimes? How should staff respond?
So it guides the staff.
Exactly. What about special equipment? Oxygen, maybe? Feeding tubes? What are the safety steps? It needs to be spelled out.
And communication, if someone has trouble speaking.
Yep, that too. Any communication challenges and clear instructions for staff on how to best communicate. Gestures, writing, simple words.
Okay, and what about being left alone?
The plan needs to say if and for how long the resident can safely be left unattended.
And if they have hospice?
The hospice plan needs to be included right in the facility's care plan. They work together.
That's a lot of detail.
Yeah.
Are there any extra bits just for assisted living facilities?
Yes, a couple of key things for ALFs from their WAC. The plan needs to show how staff monitor for risks to safety and well-being.
Proactive monitoring.
Right. And it needs to clearly state the roles of the resident, the staff, and the family, what's everyone responsible for.
Okay.
And a really important protection. ALFs cannot put clauses in the care plan asking residents to sign away rights or take responsibility for things like lost items or injuries.
That's vital. Good to know. Okay, so these detailed plans cover a ton. Sometimes, though, the care involves more specific medical tasks.
Right.
Beyond just personal care.
Exactly. And that leads us perfectly into nurse delegation.
Nurse delegation. Okay, break that down for us. What is it, simply?
Basically, it's a process where a registered nurse, an RN, teaches and supervises trained caregivers like certified home care aides or nursing assistants to do specific medical tasks.
Tasks a caregiver wouldn't normally do on their own license.
Right. Things that usually fall under nursing practice. But the RN delegates the task.
Can they delegate just any task?
No, definitely not. There are rules. First, it's only for specific allowed tasks. Second, and this is key, the resident's condition must be stable and predictable.
Meaning their health isn't likely to change suddenly.
Exactly. No rapid changes expected that would make the task unsafe for a caregiver to do.
What kind of tasks can typically be delegated in Washington?
Common ones include giving certain meds, pills, eye drops, creams, nasal sprays, sometimes feeding or meds through a stable G tube, simple wound care, blood sugar checks.
What about insulin?
Yes, giving insulin injections is a frequently delegated task, especially for diabetes management.
Okay. And what tasks absolutely cannot be delegated?
Things needing more complex nursing judgment, shots into muscle or veins other than insulin, sterile procedures, managing central IV lines, anything where the caregiver would need to make complex decisions on the spot.
So the caregiver needs special training for this. Not just anyone can accept a delegated task.
Absolutely. First, they need their basic certification, like HCA or NAC. Then they need specific nurse delegation training. There's a core 9-hour course.
9 hours.
And if they're going to do insulin, there's an extra 3-hour course specifically for diabetes delegation.
Okay. And the RN doesn't just teach them and walk away, right?
No way. The RN delegator has ongoing responsibility. Big time.
Like what?
First, they assess the resident, make sure they're stable for delegation. Then they assess the caregiver, make sure they are competent and safe to do that task for that resident.
Checking both the person and the caregiver. Makes sense.
Then they teach the task for that specific resident, and then comes the supervision. The RN has to check in regularly.
How often?
Usually at least every 90 days, sometimes more often if needed. They check the caregiver's skills, the resident's condition, make sure documentation is right. It's all about safety and making sure it's still appropriate.
So why is this process so important for AFHs and ALFs?
It's crucial because it lets people with stable medical needs stay in these home-like settings. Without it, someone needing regular insulin shots or tube feedings might have to go to a nursing home.
So it keeps people in less restrictive environments.
Yes. It allows them to get the specific care they need from staff who are properly trained and supervised by an RN right there in their adult family home or assisted living place. It promotes aging in place.
That's a huge benefit. Okay, wow. We've covered a lot, the pitfalls of generic plans, the detailed WAC rules, what goes into a good plan, nurse delegation. It sounds like, well, a lot for providers to manage.
It really can be. Keeping up with the WACs, making sure every plan is truly personal and current, getting nurse delegation right, it's complex. And mistakes can lead to citations, or worse, put residents at risk.
And I guess this is where getting some outside help can be really valuable, like what Precision Assess does.
Exactly. This is our focus at Precision Assess. We help facilities navigate all these requirements. We create those customized RN-written care plans specifically designed to meet Washington WACs.
And you start with a deep assessment, not a template.
Always.
Hmm.
Our RNs do a thorough assessment: physical health, cognition, behaviors, mobility, risk, preferences, everything. That detailed info is the foundation for a truly unique plan.
And you help keep them updated, which you said is a major issue.
Yes, that's a core part of our service. We work with the facility to update plans whenever needs change, helping them avoid those common citation pitfalls.
Can facilities access this help easily? How do you do the assessments?
We try to be flexible. We can do assessments and help with plans via phone, secure video calls, or in-person visits, depending on what works best.
And you handle nurse delegation too.
We do. We provide nurse delegation services. Our RNs can do the assessments, determine if delegation is right, provide the caregiver training, and do the ongoing supervision and documentation that the state requires.
So you're providing that RN expertise for both the detailed planning and the delegation oversight.
That's the idea. We partner with the owners, the managers, the caregivers, and the families. We want the plans to be compliant, yes, but also practical and truly centered on the resident. It helps that we're a nurse-owned and operated clinical assessment is in our DNA.
This has been super helpful. It really clarifies why personalization is key. So
Yeah.
for everyone listening who's working in or running a facility, what's maybe one or two practical things they should do right now after hearing this?
Okay, first step. Go look at your current care plans. Pick a few, maybe for residents with more complex needs. Ask yourself honestly, is this plan truly unique? Does it have specifics about this person's preferences, routines, how to handle their specific behaviors?
Or does it look like it could be for anyone?
Exactly. If it looks generic, you know you've got some work to do. That's your starting point.
Good first step. What's another?
Second, think about residents getting help with tasks like meds, blood sugar checks, insulin, wound care. Are those tasks that might require nurse delegation under Washington law?
Okay.
If yes, is that process actually in place? Is there an RN involved? Is the caregiver properly trained for that task? Is there ongoing RN supervision and proper paperwork? Check that delegation piece carefully.
So audit your plans for individuality and audit your procedures for tasks needing delegation.
You got it. Getting these things right isn't just about checking boxes for the state. It's fundamental to providing safe, dignified, quality care. That precision really matters.
It's about the quality of life for the residents, ultimately.
Absolutely. Quality care comes from that precision, that attention to the individual, not from cutting corners.
Well, this has been a fantastic deep dive. Really highlights the importance of getting care plans and delegation right.
Hope it was helpful.
Definitely. So if you're in Washington State and feeling like you could use some help, making sure your care plans are truly customized, meeting those WAC requirements, or if you need assistance setting up or managing nurse delegation services, or even help with placement assessments,
Then reach out to us. We're Precision Assess, and we're here to help you ensure compliance and elevate the care you provide.
thanks for tuning in, everyone.